All right, let's start this morning with something that is on everybody's mind. Cervical cancer has been in news for various reasons. First, for the budget allocation for vaccines for young girls this year, and then it popped up during the conversation between Bill Gates and Prime Minister Modi as well. But did you know that cervical cancer vaccines that are recommended for girls, in fact, are now being considered for men as well? By now you know that, or you should know, as I say, that cervical cancer is caused by a human, the papilloma virus. It's called the HPV, and it can be totally prevented only if you take the vaccine shot. And this HPV virus can be infected, can affect, in fact, not just women, but also men. In fact, did you know that almost 1 in 3 men worldwide aged 15 and older have at least one strain of the HPV, one type of the 150 strains that are really out there? Yes, men can also get HPV, and it's important to know that some types of HPV can also lead to cancer. Even the World Health Organization now has underlined that men can carry these infections. In men, HPV infections often show up as warts in their genital areas, causing discomfort and making it easier to pass HPV to others. HPV is also linked to certain kinds of cancers in men like anal, even throat cancer. In fact, a study published in the Indian Journal of Cancer in 2019 found that the prevalence of HPV infection in Indian men is high, and nearly 1 in 4 Indian men are infected with the HPV. Now that's an alarming, sort of situation, considering that we already knew that the virus is responsible for killing almost 75,000 women from cervical cancer every year. Now we know that it could be damaging for Indian men as well. So let's try and understand this in a little bit more detail. Now, when it comes to cervical cancer, we have spoken about this on the program earlier as well, when we talked about the connection that it has, HPV infection has to cervical cancer. Again, important to underline that not everybody who gets the HPV virus will end up with getting cervical cancer, but those who are detected of HPV have a very high chance in certain cases. We so far knew that it's mostly for women. Now studies tell us that men are getting it too, and the highlight here is, or perhaps the silver lining in all of this, is the fact that there is a vaccine which everybody can take now. So let's understand this in detail. I'm joined now by Dr. Dhwani Mago, Senior Consultant and a gynecologist at the department in the Apollo Hospital and SCI International Hospital in New Delhi. Good morning, Dr. Mago. Thanks so much for joining us on the Breakfast Club. Let me first, ask a very fundamental question here. Now, we understand the difference between cervical and cervical, right? Like cervical, the spine, and cervix, the area that connects, the narrow end of the uterus that connects uterus to the vagina. That's the birth canal, really. So the first question that really comes to mind is, when we talk about cervical cancer, men don't have the cervix. So how does this really work? Why are we saying that men are equally at risk?
Hi, good morning. So, thank you so much for having me. And yeah, you're absolutely right. Men don't have a cervix. In fact, I feel that a lot of people are really confused as to what part of the body is cervix. I just want to show you a small model of the uterus. And this is the uterus, right? And what is the cervix? It is this lower part of the uterus that we call the cervix. So, this is the part that holds the baby while you're pregnant. So, and this is the part that we screen for cervical cancer. So, obviously men don't have a cervix, but why we are trying to vaccinate men? See, HPV virus, it is, there are 150 kinds of these viruses, and they are spread both in men and women. So, HPV is mostly 99% of the times it's a sexually transmitted virus. So even in men, it is transmitted, through the sexual routes via, either it could be due to oral intercourse or anal intercourse. So men are, more likely to get anal cancers, oral cancers, or penile cancers. So that is the reason that, it is highly recommended now that Gardasil 9 vaccine has been launched in India since the last almost 2 years. So which is recommended for men to prevent all these kinds of, oral cancers, anal cancers, and penile cancers.
So the vaccine that is out there in the market, is it the same for men and women?
Yeah, so there are variants of this vaccine. As of now in India, we have 3 variants. So the first one I would start is Gardasil 9, which is a nonavalent vaccine. It covers 9 strains of this HPV virus. And that is advised both for men as well as for women. And the second kind of vaccine is Gardasil 4. That one, as of now, the studies have only been done in women. So in India, we are as of now not recommending Gardasil 4 for men. And the third one, the latest that is launched, is the Cervical vaccine, which is a Indian-made vaccine. And that is also a quadrivalent vaccine, that covers only 4 strains of the virus. So that is also, as of now, only recommended for women.
I see, I see. So how, what is exactly the efficacy of these vaccines?
So the efficacy, it really depends at what age you are taking the vaccine. So that is the reason we recommend that you start taking the vaccine as early as 9 to 10 years for both for boys as well as for girls. So the efficacy, the Gardasil claims is almost 97% if you take it between 9 to 12 years of age. And gradually, over the years, the efficacy will keep decreasing. So they say between around 14
You're saying
to 18
earlier
years,
you
it could be
take the
somewhere
vaccine,
around 86%.
I see. So you're saying earlier you take the vaccine, the better chances of it working on your body?
Yes, exactly. Because it takes, it takes a few years for the vaccine to, have a complete 100% effect. So that is why, some people have this confusion that, you take it just prior to your first sexual intercourse, but it's not like that. It has to be taken, the ideal time has to be between 9 to 12 years of age.
I see. And what about the side effects of these vaccines since it's going to such young adults?
The vaccine as such does not have any major side effects. Like any vaccine, you could just have an arm pain because we generally give it in the arm, or you could have a slight fever like any other vaccine. And there are no, major side effects of this vaccine are very rare, I would say. So like even if you take a medicine, you could have a side effect. So, but generally, we recommend, because if this vaccine is claiming to prevent such drastic diseases, like cervical cancer, anal cancers, and oral cancers, so definitely, I think if you weigh the pros and cons, you must go ahead and take it.
All right. So, tell me this, Doc. So, those of us who are in our 30s now, men and women both, and still want to take the vaccine, does it make sense to take it now? Should adults, should people post their 30s, women are most susceptible to cancer in their 30s, right? So does it make sense to take the vaccine now?
Yes, definitely. You must take the vaccine. See, the efficacy of the vaccine will reduce definitely, but still you will get some benefit from the vaccine. And also, there are many times that the women or the men are not exposed to the HPV virus till that age. So that is the reason that, even after deliveries, a lot of times we are giving the vaccine, because in India, you never know, many women may not be affected with the HPV virus till that age.
Yeah, I think the point you're trying to make is that you might still be affected with the HPV virus. It might not convert into cervical cancer, but it's important to take prevention. That's one bit of it. But again, there are so many questions on availability
the age limit,
of these.
Yeah, for women, in fact, we are giving the vaccine till 45 years of age. As of now, the women can opt to take it till 45. And also after 45, if a woman feels that she wants to take it, she can discuss with her doctor and go ahead and take it. For men, as of now, the age limit is still 26 years. But again, like I said, if men are willing to take the vaccine beyond 26 years, they can discuss with their doctors and opt to take the vaccine.
I see. I see. But Dr. Mago, talk to us a little bit about the availability of these vaccines, since we now understand that a cheaper version, made in India version, is going to be available soon. It's not there in the market just yet. But would you say these vaccines are mostly available in the metros at the moment?
No, these are the vaccines are available worldwide, but I really feel that the education and the knowledge regarding these vaccines is much more in the metro cities compared to the smaller cities. And even here in the metro cities like Delhi, when I educate my patients, I see that almost 60 to 70% of the women don't know about the vaccine. So availability is definitely there. The Gardasil 4 has been available since 2008 in India, and Gardasil 4 is now Gardasil 9 is available since last 2 years. So I feel that the awareness is not there, and now that the government has launched in the budget also, they are planning to vaccinate all young girls between 9 to 14 years of age. I think that is a very good step, and that will really benefit a lot of girls.
Yeah. Dr. Mago,
and regarding the cost,
from our research, we figured out that there are about 150 strains of HPV viruses that are there, right? Now, the vaccines you've spoken about cover, some cover 4, some cover 9 strains. So, really, one has to wonder, have we got a full 360 view on this? Because these strains we now understand because of COVID keep evolving, keep changing, and there are a whole host of them really out there. So how effective are these vaccines really?
Like I said, almost, the Gardasil 9, which is covering the high-risk viruses. See, we are more worried about the high-risk viruses. Yeah, you are right. There are 150 HPV viruses, but what is, what causes the cancers are the main, HPV 16, 18. Those are the main 2 high-risk viruses, and also 6 and 11. So we are mainly focusing on those viruses. Yeah, there could be some cancers, about say 2 to 3% of the chance could be there that you could be affected from some other cancer in spite of taking the vaccine. But still, I think 97% is a very good number, and I feel that everyone should go ahead and take the vaccine.
I see. I see. All right, Dr. Mago, thanks so much for joining us and clarifying all those queries that we have on cervical cancer over there. The government is recommending it. Doctors are saying that let's educate ourselves and understand this. And now the fact that men can get it too, the numbers are really staggering, as you pointed out. And the fact that these vaccines actually do cover men, that's something that we must sort of consider and look into as well. Thanks so much, Dr. Mago, for joining us.
Yes, thank you so much.